So good afternoon, everyone. I know I'm at the end of what I imagine has been a very full day, so thanks so much for hanging in there. My name is Amy Cohen, and I am the Patient and Family Centered Care Program Manager at the Medical Center. And I will tell you just a little bit before we begin that I come to this route first as the parent of a young child with a rare disease. I have a soon-to-be 11-year-old son who was born with a rare condition called bacterial association. And at the time that he was born, I had a very different and very full life and a different career that I loved very much. As most of us have probably experienced, my life was very much shaped by my son and what was going on with him from a medical perspective. And so I experienced what I imagine other people sort of do, that sense of always feeling a little bit like you're in the wrong place. When I was at work, I was feeling like I should be doing more to guide and advocate for his care. When I was with him, I was feeling like I should be somewhere else. And so it was a sort of what I imagine as a very familiar pull. My son really led me in a different direction, and that direction began one day when he was recovering from a surgery on the inpatient pediatrics unit here at our children's hospital. And I saw a very small sign on one of the walls that said, you know, help us shape what inpatient pediatric looks like at the medical center. And I thought, you know, it said like, you know, share your voice, you have some perspective. And I thought like, I have something to say. And I will say that he's in general had pretty exceptional care, but like anyone who spends a lot of time in healthcare, I thought, you know, they should probably hear from me about some things. And so it said, like, contact our nurse manager. And I was like, I'm going to walk down there and contact her. And then I realized that I hadn't slept or showered in many days. And I thought, this may not be the moment to commit to something that I may feel less passionately about when I'm at my home and we're back to our typical routine. And so I did nothing. And sort of sat on that information for a couple of months. And I saw a similar sign maybe 6 months later when I attended the VFN annual conference. And at that time, of course, things were stable. I was feeling pretty good. And I realized that I had that same energy in terms of thinking about how we could use our experience. And so I did reach out and began my work that I'm going to talk about today as a patient and family advisor. And then a couple of years later, our medical center decided that patient and family centered care is something not just that we should be doing for sick kids and their families, but something that we should be doing for all patients and families across the healthcare experience. And so I transitioned from my previous professional role into this newly created position at our organization to oversee our efforts to become more patient and family centered. And so what I want to do today is share a little bit about what patient and family centered care is, and then hopefully make some connection to all of you and how using your experience as patients and families can shape the future of healthcare, both here locally, but also nationally. Think about that perspective. So the first thing, and I often share this when I'm talking with staff across our organization, is just highlighting that patient and family centered care is not just being kind and compassionate to patient and families. We're all hoping that our healthcare providers come with that perception and sensibility, but it's really a different way of approaching healthcare, and it's based on the concept of mutually beneficial partnerships. And so the phrase that really often hits home for people when you describe what's different between caring for patients and families and being patient and family centered is the idea that patient and family centered care is really working with patients and families rather than doing to or for them. So it's really about that sense of partnership. Are we creating that sense of partnership where you feel like an equal and valued partner in the healthcare experience? There are 4 core principles, and we spend a lot of time now teaching our staff across the organization about the meaning and importance of these principles. And the first is just the concept of dignity and respect. And it's really the idea that we need to be encouraging our providers to listen to and honor the patient and family perspective, their choices, and to incorporate their values, beliefs, and customs into the delivery of our healthcare. And it's particularly true, I think, when we think about families who are dealing with rare diseases. They know a lot, often more than the healthcare providers that they're engaging with. They have strong perspectives around what's beneficial for their child or what's beneficial for their family member and how they'd like some of that care to be delivered. And so it's really creating a healthcare system where we honor that voice and that experience. The second is around information sharing, and that organizations that are working to become patient and family centered. I know this is not a journey for the medical center alone, but hospitals around our region and certainly across the country. We're really working to improve information sharing so that patients and families receive timely, accurate, and complete information. And the focus is really supposed to be on providing information that can be meaningfully and easily understood by the people who are receiving that information. Always that becomes more of a challenge when we're talking about really complex topics, but also providing information in a useful and affirming way. And to do that so that people have an increased opportunity to really be effective decision makers in their own healthcare. The third principle is just the concept of participation and the idea that patients and families should be encouraged and supported to be active participants and their healthcare planning and decision making, moving away from the traditional medical model of sort of giving patients and families the instruction and expecting that they do that and really giving them a chance to be part of the discussion. And then the final principle, and the area that we've had the most to learn in healthcare most recently, is the concept of collaboration. And it's the idea that patients, families, and providers collaborate around all aspects of policy development, program planning, service implementation, design of our healthcare spaces and facilities. And so we're making kind of mutually beneficial partnerships. And I think Allison gave a great example of collaboration before in the work that you're doing around the newborn screening, that we're not just deciding what that script might look like and how it should be delivered, but you're actually listening to the people who've been on the other end of that receiving phone call and asking them, what would you like to see? What do you think would be helpful? How should we script this? How should we craft this language so that we're achieving our desired impact? So a couple of just quick slides to contrast patient and family-centered care with other approaches to healthcare. The traditional old-fashioned model of healthcare is often called system-centered healthcare. Some people refer to that as physician-centered healthcare, with the idea that it's really the needs or the benefits of the system that drive the delivery of care. So, we schedule our clinic hours based on what works well for the doctors as opposed to what works well for patients and families. We also schedule our appointments based on how many we can get in at a certain time and how we can move them through the system most efficiently because it works well for us as a healthcare organization, but not necessarily because it works well for patients or families. Many people think that patient-focused care is certainly an improvement from system-centered care. And the idea with patient-focused care is that staff really focus on the strengths and the needs of the patient, but don't necessarily see the family as a potential partner in care. And certainly, when we think about kids who are going to grow into adults with complex health needs, really building a healthcare system that values the role of family is pretty critical. Pediatrics, we love to talk about family-focused care. And again, I think on the surface that language sounds appealing. The idea with family-focused care, though, is really the family is the unit of intervention. So we're not just intervening around the kid, but we're going to wrap this family in supports. We're going to really focus our attention on what this family needs. And again, it's an example of kind and compassionate care. But the difference is that family-focused care really thinks of the family as the unit of intervention. We're going to do to or for this family, something that we think they need, as opposed to our goal state, which is patient and family-centered care. And it's the idea where the priorities and choices of the patient and their family really drive the delivery of the care. So moving from a to and for model to this concept of working with patients and families. So that's a little bit of a kind of theoretical overview. And often when I share that with medical staff, there's not a lot to argue with around those concepts. But often what they say is like, that sounds fine, but what does it look like? What does it mean in terms of practice? And so at our organization, we've developed some standards for patient and family-centered care. And we're not necessarily there yet, but these are some of the things that we think when we are fully patient and family-centered, our staff would be able to read and say, yes, absolutely, I do this, I believe in this. And so I won't read them all, but you can take a second to sort of look at some of the highlights of them. Some of the things are we allow patients to define who their family is. We allow families to decide who they want to be involved in their care, that we involve patients and families in planning and delivery of health care, that we support people to choose kind of how they participate, that we welcome them all throughout our organization at any time, regardless of things that are happening in the hospital. That becomes particularly important for adult healthcare. It's been the norm in pediatrics for quite some time, of course, that families are welcome at any time and part of the healthcare team. But until relatively recently, that has not been the case for adults. And so for many of our transition age youth, it's been quite a shift to suddenly enter healthcare systems where your parents can't accompany you and can't be with you when you need support, or your family as you define them. Some other shifts that we encourage and support family members to be present during procedures and treatments, if it's the preference of the family and also the preference of the patient. That we think about providing information to families and patients themselves in ways that are going to be helpful and supportive and nurturing. That we really consciously think about providing easy and accessible opportunities to ask questions. And I think many of us will acknowledge that that's not always, even providers who think they do that well, it's not always easy to do. And provide emotional support as part of our responsibility for caring for the patient and the family. So a couple of quick slides here just to highlight that patient and family-centered care is more important than just providing kind of feel-good care. There's lots of clinical evidence that suggests that when we really incorporate the patient and family presence and decision-making, that there's lots of positive benefits to the patient. And what I'm reviewing here is kind of both pediatric and adult healthcare literature. But the research shows that when you welcome family presence and participation and really allow them to be part of the discussion and decision-making, patients have decreased anxiety, confusion, and agitation. They have less cardiovascular complications when they're hospitalized. They report feeling more secure, more satisfied. We have real improvements in quality and safety of care. When you really allow the family to be part of the discussion, they often can point out things that we have missed or errors that might have been made that if they weren't part of some of these larger discussions wouldn't be the case. It reduces the length of stay when a patient is hospitalized, and we know that most patients are safer when they're out of the hospital than they are when they're in the hospital. Improves overall health outcomes and lowers healthcare costs. So certainly from an organizational perspective, there's a lot of reasons why we need to be working to embrace this concept. From a family perspective, similarly, less anxiety, less fear, improved satisfaction, but really more opportunities for patients and families to be involved in the teaching around care that's required outside of the medical center or outside of the hospital if they've had an inpatient stay. So the more that we really include families in the discussion about the care and ask them what their preferences are, what they think is possible and realistic for them at home, the better outcomes we have. And then finally, for staff, sometimes when we're making a change across the medical center, our staff initially balk. The idea that they have more time to talk, more opportunity to listen, seems like a hefty demand. But the research suggests that after a period of adjustment, that most staff report that they have improved job satisfaction, and they get better information when they build in systems that actively allow them to listen and take time with families. They're better able to prioritize and manage the care demands that they have when they hear from you about what's important and what you think is critical for your loved one. Better staff relationships and increased efficiency in work. And so I'm just sharing those slides to highlight for you all as potential advocates in the future that this isn't just to make you feel good, it's to result in better, safer quality care. So a couple of notes about how patient and family-centered care is impacting healthcare. Certainly as we shift away from the traditional model where the physician holds all of the information and the emphasis is on the patient-physician dynamic, now the healthcare team becomes a much broader group of folks. We're really thinking about a team of healthcare providers where patients are members of the team and not simply objects of the team's attention. Part of what I do when I work with patients and families is sort of share that while I'm, infinitely optimistic about the importance and the impact of patient and family-centered care, I'm also recognizing and try to be balanced with folks that patient and family-centered care is really about an evolution, and it's about changing the way that we view our practices and really trying to shift that to the lens of the patient and family. And while that's important, these are all large healthcare systems and change takes time. So I want people to be excited about the potential of your impact, but also recognize that, as I said, change can be slow. It's certainly a journey. in terms of how we get there and the role that you can all play, one of the things I just wanted to highlight today and why I'm so appreciative of the invitation is that partnership is really, participation is really key to true partnership, that you all have to have the opportunity to participate and develop that partnership with your providers and really help be teachers to them in many ways. And so providers, families, patients all play a critical role in kind of helping to build that partnership. So some of the ways that we are moving towards patient and family-centered care across the medical center, and again, I'll highlight this work is happening in hospitals across the area and across the country. So if you don't access services here at the medical center at our children's hospital, certainly be aware for some of these opportunities in other places. We're working hard to recruit patient and family advisors. And those are people who have used services at our medical center or at our children's hospital in any capacity. You can be an advisor if you've been a patient, if you've been a family member of a patient, anyone who's had recent experience and feels like you have something to give back in terms of shaping the way that we do the work that we do there. Some of our advisors have chronic illnesses and spend a lot of time in the hospital and access a lot of different services. We certainly have other folks who access the medical center for primary care and the occasional specialty visit. And so the goal is really that they represent a diverse and unique population. And so we need to hear from all folks, not just sort of the most typical cases or the most common diagnoses. And so there's lots of opportunities to get involved. Our advisors then participate on committees, work groups, projects across the organization where their role is really to represent the patient voice and perspective. And so again, I'm glad that I had the opportunity to follow Allison today because she gave some nice examples of how she's already using her family experience to serve as an advisor for other organizations or other capacities. And really, it's the person to sort of speak up and say, like, I don't know if that's going to work for families. I know it would be really hard for me to, you know, get an appointment using that procedure or follow that instruction if that's what you gave me to do at home. So it's really to sort of share your opinion and share your experiences and be the only person at the table whose sole responsibility is to be thinking from the patient and family perspective. And what I often say is that our staff hopefully are coming to the table with the best interests of the patient and family in mind, but they haven't lived the experiences that all of you have lived. And so you're the only person that's thinking just about the needs of your child and your family rather than your workflow, your supervisor, the political climate of the hospital. You're just speaking from your own perspective. We also have several patient and family advisory councils. We have a University of Vermont Children's Hospital Advisory Council, and we have some members who are already here today. We have a medical center-wide advisory council, and these groups are really sort of directing our work rather than responding to the things that we've already identified as priorities. So they're the folks saying, you need to do a better job with giving families information about how, the inpatient unit works or what they can expect when they come to their first specialist visit. And then we're responding to those and working together to create some systems to support people. And we're really working hard around incorporating patient and family story into our education and training. And so your ability to sort of tell your story, particularly because you're all managing unique, complex challenges, to share what that experience is like for the medical center is particularly critical. And so we have lots of people involved in storytelling in a lot of different ways. Just talk about, this is what it's been like for us, this is what it's like at our home, here's what happens when we come to the medical center, and here's what we find challenging, and here's what can be particularly helpful. Some other examples of ways that we're trying to improve information sharing. We recently committed to something called Open Notes at the medical center, where you can after you have an outpatient visit, you can log on to our online portal and you can actually read your provider note that they wrote after the visit that they had with you. And it's a real way to increase transparency in healthcare so that you can actually read what they wrote. If many of you have probably had the experience of having an appointment and leaving and thinking to yourself, like, I have no idea what we just decided or discussed there. Or I always share the example that in the very few early weeks that my son was home, my husband and I had the brief moment of thought that we were going to split appointments. We were both working and that he would go to some and I would go to the others. And I sent him with a lengthy list of questions and I'd come home and say, how'd it go? And he'd be like, it was good. Like, and what did he say? Said things were good. I feel like, I'm sorry, that's not helpful to me at all. And shortly after we stopped sharing appointments, but I can imagine now that if we had done that and I had been able to log on and read that note, that I would have had a much better idea of sort of what this discussed in the visit, what the physician's plan was, what the next steps were for my family. And so it is really an opportunity to go back and sort of say, like, do I understand this? Do I have the time to digest it when I'm calmer? Can I share it with someone else who's helping manage my care with me?
So would it be fair to ask the providers to kind of go back and upload the previous notes?
So they don't automatically upload. We launched this mid-June, and they are available as of June forward. They can't go back and upload them into the system, but you can access them by requesting your health record. And it's certainly appropriate. Those have always been the right of the patient to request those. We've just made it really hard to get that information. Yeah. Yes.
I like that it's like in the system, and I noticed that change. It was great to get. I was like, oh, notes. When did that happen? Thank you.
Yes, it's a big deal.
Yeah.
And a shift, certainly.
Yeah.
And I'll skip to just below in the interest of time. We have a lot of work going on around improving patient and family education and integrating the way that we provide education into multiple settings. And so there's a lot of opportunity for all of you to help shape what education looks like in the healthcare setting by reviewing patient education materials, giving us feedback, telling us, does it answer the questions that you would have if you'd received that brochure, that pamphlet, that piece of information, so that we're really providing more consistent information and more patient and family friendly information. A number of processes are going on to improve barriers to participation. So we recently eliminated our visitation policy in favor of a family presence or welcoming policy. And the idea is that patients and families should decide who's at your bedside and how they're involved in your care. And so if it's helpful for you to have your best friend in the room while you are sitting by your child's bedside, then we shouldn't be telling them when they can be there and when they need to leave. That should be up to you to do. We're really committing to patient-centered nurse report. This is the idea that at change of shift, when your child is hospitalized, that the nurses are coming to the bedside and sharing information at change of shift with you as an invited participant in the discussion, so that you can stop and say, like, that's not really accurate, or actually we know that that hasn't worked for my son in the past, so I'm hoping you can make a different plan, that you can really be part of the discussion rather than just sort of someone who receives the information and decisions made. And the same is true for rounding, that we're really working hard to make rounding something that always happens at the bedside, and not just something that you listen to as sort of a silent participant, but that you're part of the discussion during rounds about what the plan for the day is and what your questions are. So I only know I have a couple of minutes left. These are some of the things you can do to be a partner with your healthcare team. The first is just to encourage people, and I know how hard it is to do. I've lived that experience as well, but be sure your healthcare team knows what's important to you and your family. Articulate your needs, preferences, and desire for information. I think in both healthcare and education for kids with complex needs, there still is the tendency to share with families what we think they're ready to hear. And we really need to shift that dynamic and have families tell us how they'd like to receive information. So certainly some people might say, like, I need to know, what I need to know for the next 3 months, because I don't think I can handle your 20-year prediction. But some of us want to say, like, I want to know if this is, if my son's never going to be able to do this, or he won't have this function, it would be helpful for me to know. And so articulating your preferences for how you like to receive information is important. Share with people how you want to be, who you want to be involved in your care, and how you want them to be included. And so if you want to always bring a friend with you to an appointment because it's hard for you to process and pay attention to your child and give information, then let your healthcare team know that you want someone else to be involved. Decide how much you want to know. I think I already gave an example of that. And also decide how you want to make treatment decisions. I think some people want to know every option and possibility and really be the decision maker. Other people are very clear that they're looking for more direction from their healthcare team. And so thinking a little bit about that and being upfront can be very helpful in terms of getting the kind of healthcare you want. A couple of other things, really encouraging people to speak up when you don't understand. And of course, we all hear that, but again, it's hard to do in the moment. But that's part of the way that we're going to change what healthcare looks like and how we make time and space for questions and shared decision making. It's very, very helpful to write your questions down in advance, and sometimes to share them in advance can be really helpful. And we have to start thinking about how to use technology to help us better manage care for our complex kids. So asking to record a conversation, the first time that you ask, your providers may balk, but that's becoming a more common request. And so don't hesitate to say it's helpful for you. Hopefully the advent of things like open notes makes that less necessary, but it can be helpful. Ask the team to talk with one another in addition to talking with you, particularly if you're receiving conflicting information. And again, I think those of us who see many specialists, lots of different people weighing in, that's a lived experience of having, one person give one perspective and the other give another. And oftentimes that responsibility falls to the family to sort of help navigate that. And a simple way to navigate that is to say, you're the third person that's weighed in on this, and you're the third answer I've gotten, and so I'd like you to all talk and have someone get back to me. Ask for role clarification when you need it. I think one of the pieces of feedback that I receive the most from patients and families is that it's hard to keep track of who's on your team and how they're involved in your care, and what their role is, so ask for it if you don't get it. And then finally, really think about giving feedback. Oftentimes when we're unsatisfied with one of our interactions, if we have the resources and the ability in another person, we think our feedback is by moving providers. And that's a great thing to be able to do, but we also need to give feedback when things haven't worked well about why you're making a shift or why you'd like to make a shift if there was another shift you could make. And then finally, there's lots of ways that all of you can be involved in systems improvement. And so again, like the story we just heard, I really encourage people to think about sharing your story, regardless of whether you want to become a patient and family advisor. And you can do that in person one time. You can do that many times across our system. You can join organizations that have the ability to sort of share stories. You can do that in writing by just writing what your experience is so that we have the opportunity to share it with others. And I'm always happy to collect those stories. And sometimes for people who aren't comfortable standing in a large crowd, we record the story on video so that we have the opportunity to learn about your perspective living with a rare condition and share it with others who may not be familiar. I certainly would love to welcome many of you to become patient and family advisors, or certainly in our system, but if not, I encourage you to volunteer and share your patient and family perspective in another setting to really continue to spread the voice of patients and families across our healthcare system. And again, offer feedback. If things aren't working for you, be vocal about what that experience is and how it can be improved. So I know I'm at time. I saw the cards, but I'm happy to answer questions if there are any questions. Yes?
Is there a training for to be a patient advisor?
Yeah, so all of our advisors, we start by having folks fill out an application, and what we ask people to do in the application is just tell us some of the things that your healthcare providers have done that you appreciated, that made you feel valued and respected, and give us an example of something that you think your healthcare providers could be doing better. And part of asking those questions is that we're really looking for people who could talk about both what's working and what's not, that we want to hear both of those perspectives. What does it feel like when you really feel care that's connected to who you are, and what's missing when you don't feel it. And then we meet in person and talk a little bit about your interests and how you'd like to be involved. And then anyone who decides to become a patient family advisor goes through an orientation where we just talk a little bit about the role and some of the things that come up and the different ways that you can potentially be involved. And so I think the folks who come to that work come to it for a number of reasons. I think these experiences that many of us are living with are so intensive, and I think for some it's the chance to make some meaning from that experience and share with others to hopefully make the road easier for people who will come after you. For some, it's really that you have some strong thoughts about how things could be improved or look different, and you really want to share that knowledge with other people. And I think there is a little bit of a sense of, I don't know if you would agree with this, Amelia, but I do think we don't intend this to be a support groups. There are other places where there are support groups, but I do think we do appreciate the camaraderie of being with other people who are patient and family advisors and hearing their perspective and their ideas and sort of sharing that perspective. So I think that's some of the value as well.
I know when I sat on it, there was food.
Yes, and there's food.
Yeah, all of you start with pizza party.
Thank you so much for having me.
Well, thank you everyone for coming today. I do want to thank all the speakers who took their time to come and share about their resources or provide information and education. I want to thank the attendees for coming and everything that you offered through questions and comments and all sharing your own resources. And I also want to thank Dr. Leah Burke, who, when I first approached her with the idea of having this conference, she never even hesitated and has been working with us throughout this whole thing. So I really appreciate that. Thank you.